Welcome back, my YouTube family. If you are on Medicare, I want you to think about the last bill or explanation of benefits you received, the document that shows what Medicare paid and what you owe. Most seniors look at that number, assume it is correct, and pay it. And that is exactly the problem. Medicare billing errors are more common than most people realize. Studies by the Department of Health and Human Services have found that improper Medicare payments, meaning payments that were billed incorrectly, coded wrong, or charged for services not covered as billed, run into the tens of billions of dollars every single year. Some of those errors result in Medicare overpaying providers, but a significant portion result in seniors being billed for amounts they do not actually owe. Today, I am going to walk you through the 5 most common Medicare billing errors seniors overpay for without realizing it, how to read your Medicare summary document to catch them, and the specific process, including the form and the phone number, to file a correction request and get your money back. Stay with me. Before we get into the billing errors, if you are not subscribed yet, please hit subscribe and turn on the bell notification right now. Medicare sends paperwork that most people do not understand, and most providers do not explain. What I do on this channel is take that paperwork, the explanation of benefits, the Medicare Summary Notice, the plan notices, and break down what they actually mean and what you can do when something looks wrong. If that is useful to you, subscribe and turn on the bell. Now, let us get into the 5 billing errors. 3 billing errors Medicare seniors overpay for most frequently. Error number 1. Being billed for a service Medicare covers as preventative at no cost to you, meaning no copay, no coinsurance, no deductible, as long as the service was ordered for preventative purposes and billed correctly. This list includes your annual wellness visit, mammograms, colorectal cancer screenings, diabetes screenings, bone density tests, lung cancer screenings for eligible smokers, and more. The billing error happens when a provider codes the visit incorrectly, or when, during a preventative visit, the doctor also addresses an existing condition. When that happens, the visit can be split billed, the preventative portion at no cost, and the treatment portion billed as a regular office visit with a copay. Many seniors are surprised by a bill after what they thought was a free annual wellness visit. The bill may be legitimate if the doctor addressed a separate medical issue, or it may be a coding error. You have the right to ask your provider for an itemized bill showing exactly how each service was coded and why. Error number 2. Duplicate billing for the same service. This happens when a provider bills Medicare more than once for the same service, either accidentally through a billing software error or because multiple staff submitted the same claim. Medicare system catches many duplicates, but not all. If your Medicare Summary Notice shows the same service billed on the same date more than once, that is a duplicate billing error. You should not be responsible for any cost sharing on a duplicate claim. Error number 3. Being billed for a service that was not actually provided. This is called phantom billing, and it is one of the most serious Medicare billing problems. It occurs when a provider bills Medicare for a service, supply, or equipment that was never actually delivered to the patient. Common examples include durable medical equipment, wheelchairs, walkers, oxygen equipment, billed to Medicare without the senior ever receiving the item, or home health visits billed for days when no visit actually occurred. If your Medicare Summary Notice shows a charge for a service or item you do not remember receiving, do not assume you simply forgot. Call the provider and ask them to confirm the date and description of the service. If they cannot confirm it was provided, contact Medicare immediately. 2 more billing errors. These are the ones that cost seniors the most money. Error number 4. Being charged the wrong cost-sharing amount because of an incorrect diagnosis code. Medicare covers many services, but the coverage level and your cost-sharing responsibility can differ depending on why the service was ordered. The diagnosis code, called an ICD-10 code, that your provider attaches to the claim tells Medicare the medical reason for the service. If that code is entered incorrectly, Medicare may process the claim under a different coverage rule than applies to your actual situation, potentially resulting in a higher copay or a denial that should not have happened. For example, a physical therapy session ordered to treat a specific injury may be covered at a different rate than general physical therapy. If the provider uses a generic code instead of the specific diagnosis code for your injury, your cost sharing may be calculated incorrectly, higher than it should be. If you receive a bill that seems higher than expected for a covered service, call your provider's billing department and ask them to confirm the diagnosis code used on the claim and whether it accurately reflects your condition. A corrected claim with the right code can reduce or eliminate your out-of-pocket cost. Error number 5. Being charged for services during an inpatient hospital stay that should have been covered under your Part A benefit. This one catches seniors off guard more than almost any other billing issue. When you are admitted to a hospital, you can be classified either as an inpatient or an outpatient under observation status. From the patient's perspective, both situations look identical. You're in a hospital bed receiving care. But from a Medicare billing perspective, they're completely different. If you are classified as an inpatient, Medicare Part A covers your hospital costs after you meet your deductible. If you are classified as outpatient under observation, Medicare Part B applies, which means you may owe 20% coinsurance on every service provided during your stay, including medications administered at the hospital that you would normally receive at no cost as an inpatient. Hospitals are now required to notify you in writing within 36 hours if you are classified under observation status. This notification is called the Medicare Outpatient Observation Notice, or MOON. If you are hospitalized and never received a MOON notice, and you were billed under Part B rather than Part A, you may have grounds to request a review of your admission status. Contact your hospital's patient advocate and ask them to review your classification and explain why observation status was applied. Stay with me because the next section covers exactly how to read your Medicare Summary Notice to catch these errors yourself, and the specific step-by-step process to file a correction request and get a billing dispute resolved, including what to do when the provider refuses to correct the bill. The document Medicare sends you every 3 months and how to actually use it. Every quarter, Medicare mails you a document called the Medicare Summary Notice, or MSN. If you are on a Medicare Advantage plan, you receive a similar document called an Explanation of Benefits, or EOB, from your plan after each claim. These documents are your record of every service billed to Medicare on your behalf during that period, and they are the tool you use to catch billing errors. Here is how to read it. The MSN lists each service by date, the provider who billed it, the amount billed, the amount Medicare approved, the amount Medicare paid, and the amount you owe. Go through it line by line and ask yourself 3 questions for each entry. First, did I actually receive this service on this date? If the answer is no, flag it immediately. That is a potential phantom billing error. Second, does the service description match what I remember happening at the appointment? If you went in for a blood test and the MSN shows a procedure you do not recognize, call the provider and ask for an itemized bill with the CPT procedure codes for every service listed. Third, is the amount I owe consistent with what I expected to pay based on my coverage? If you have a Medigap supplement, most services should show little or no out-of-pocket cost to you. If you are seeing significant amounts owed that your supplement should have covered, that may indicate a billing or claims submission error. You can also access your MSN online at any time by logging into your Medicare account at medicare.gov. You do not have to wait for the quarterly mailing. You can check claims as soon as they are processed, which allows you to catch errors much sooner and within the appeal timeframes that apply. Step by step, how to dispute a Medicare bill and escalate if needed. If you find an error on your Medicare Summary Notice or your explanation of benefits, here is exactly what to do, in order. Step 1. Contact the provider's billing department first. Call the provider, explain the specific error, and ask them to submit a corrected claim to Medicare. Many billing errors are genuine mistakes, a wrong code, a duplicate submission, and providers will correct them when asked. Get the name of the person you spoke with and the date of the call. Ask them to confirm in writing that a corrected claim has been submitted. Step 2. If the provider does not correct the bill within 30 days, contact Medicare directly. Call 1-800-MEDICARE. That is 1-800-633-4227, available 24 hours a day, 7 days a week. Tell them you believe there is a billing error on a specific claim and you want to file a formal complaint. Give them the date of service, the provider name, and the claim number from your MSN. Medicare will open an investigation. Step 3. If Medicare's initial review does not resolve the issue, you have the right to file a formal appeal. For original Medicare, the first level of appeal is called a redetermination. You must file it within 120 days of receiving the initial claim decision. The request is submitted in writing to the Medicare Administrative Contractor listed on your MSN, or you can use the standard appeal form available at medicare.gov. Step 4. For fraud or suspected phantom billing, report it separately to the HHS Office of Inspector General at 1-800-HHS-TIPS. That is 1-800-447-8477, or online at oig.hhs.gov. You can report anonymously. Medicare fraud reporting is taken seriously, and in some cases, whistleblowers who report fraud that results in recovered funds are entitled to a portion of the recovery under federal law. One important protection to know. Medicare has rules against balance billing for original Medicare patients. A provider who accepts Medicare assignment, meaning they have agreed to Medicare's approved payment rates, cannot charge you more than the Medicare approved amount for a covered service, plus your standard coinsurance. If a provider who accepts Medicare assignment sends you a bill for an amount higher than the Medicare approved rate, that is a violation of their Medicare provider agreement and should be reported. Here is your summary. The 5 most common Medicare billing errors seniors overpay for are being charged for a preventative service that should have been free, duplicate billing for the same service, phantom billing for services never received, incorrect diagnoses codes that change your cost-sharing amount, and being billed under Part B observation status instead of Part A inpatient coverage. To catch these errors, review your Medicare Summary Notice line by line every quarter, or log into medicare.gov and check your claims as they're processed. Ask yourself, did I receive the service? Does the description match? And is the amount I owe consistent with my coverage? If you find an error, call the provider first. If they do not fix it within 30 days, call Medicare at 1-800-633-4227. If the issue is not resolved, file a redetermination appeal within 120 days. For fraud or phantom billing, report it to 1-800-447-8477 or oig.hhs.gov. Medicare billing errors cost seniors real money every year, and the only way to stop overpaying is to check your paperwork and know your rights. Now you do. If this video helped you, please share it with someone you know on Medicare. A neighbor, a parent, a friend who pays their Medicare bills without ever checking them. One conversation could get the money back that they already spent. Subscribe if you have not already, and I will see you in the next one.